Good afternoon, everybody, and welcome to the third CAS webinar of the 2019-2020 season. My name is Allison Del Calzo-Barons, and I'm an HIV counselor at the Family Health Center of Morristown Medical Center and the chair of the Morris County Community Assistance Services Committee. Today's webinar is Substance Abuse and Homelessness. In this webinar, we will identify the role that addiction plays in the homeless problem. Many are not homeless because of drug addiction, but can become addicts after being homeless. Why does this happen? How can we help them? What resources are available to assist these individuals? During this webinar, we will discuss these questions and more. Before we start, there are a few housekeeping items I would like to review. This webinar is being recorded and will be uploaded to the CAS YouTube channel. Comments and questions are welcome. You can enter them into the chat, or if you are connected to audio and you're not interrupting the presentation, you are invited to make comments or ask questions through audio. Just please remember that we are recording. Also, if I'm going to take everybody off of the manual mute, so if you could make sure that your phones are muted unless you do want to say something so that we don't hear any background noise, that would be great. I would now like to introduce today's presenter. Pascale Augustin is a CADC course instructor. She's going to tell you more about herself, but I did want to just mention that it is her birthday. So happy birthday, and thank you for being with us today.
Thank you. Welcome, everybody. As Allison mentioned, my name is Pascale Augustin. I'm a licensed clinical social worker and a licensed certified alcohol drug counselor. I've been doing this for about 20 plus years in this field, working with both addiction and those who are dually disordered or co-occurring. As we mentioned, today's topic is substance abuse and homelessness. One thing I like interaction. So at any time, if you have any questions or if you want to jump in and just provide some more additional information or make some comments, because I will be asking questions, feel free, just comment, just say, excuse me if I'm talking, and just talking, so we could gain some useful information to see how we can help this population, okay? So before I start, what are some of the things we know about homelessness, and what are some of the concerns we have or some of the assumptions that we have regarding a homeless population and substance abuse? Anybody care to share or just give us some input? Okay. Well, the homeless population, most people, they automatically assume that because you're homeless, you're either or a drug addict or you have some history of addiction. At times, that can be the case, but most of the time that tends to happen after the homelessness occurs. And there's different reasons or different variables that contribute to individuals being homeless. So it's not necessarily that they were addicts, full-fledged addicts, they hit their rock bottom, they lost everything. It could be the total opposite. It could be working homeless, as we all know. So as we continue to discuss throughout this session, this hour or so, we'll identify those resources, we'll identify those variables, and see how we as professionals in this field can try to engage and try to help them. So one of the theories I like to go by is that every day you wake up is another day to work towards your goals. So which means at times when you feel like, hey, you know what, I've reached my rock bottom, I reached my, or I'm at the point where I feel I can't continue on anymore, what tends to happen is if you get another day, you open your eyes, so you know what is my goal for today? What is my opportunity to try to press forward towards the mark, the prize that I want, the opportunities that I want to achieve in my life, okay? So introduction, this was done in 2017. That was the most research that was done. It says approximately 554 people are homeless there are 554,000 homeless people in the United States. You're like, how is that possible? It's the United States, you know, with the amount of resources that's available, with the amount of money that we have, the opportunities, you would think that number will be relatively low. Unfortunately, even from January 2017 until around June or so, it only went down about 1,000. So it's still high within this. The end result of homelessness is often substance abuse. As I mentioned before, homelessness is either what has come first, the chicken or the egg. Depending on the person's circumstances, it's most likely homelessness comes addiction comes after the homeless factor, okay? Substance abuse often contributes to homelessness. The National Coalition for Homelessness has found that 38% of homeless people are alcohol dependent and 26% are dependent on other harmful chemicals, which that opens up doors to be cocaine, marijuana, okay, heroin, pills, those that will be contributed to 26%. There are 864,000 homeless men and women and children across the state of the United States of New Jersey itself. So I gave you the national number, and now I'm giving you the state number. And in Morris County itself, it has 398 homeless people. And Morris County is pretty much one of the very lucrative or very wealthy counties, similar to Bergen County. And to have that amount of homeless people, you wonder, why is that possible? Okay, where are the resources going to? Where are the funds going? How can we create an impact to decrease that? And as I mentioned before, there's also working homeless, and there's different type of homelessness, which we'll identify later. There are 1,462 persons and 1,351 households were identified as chronically homeless, increase of 174 persons, or 8.2 compared to 2018. Okay, so the chronic homelessness ones, that will be considered the individuals who are they're living with friends, hopping from house to house, that there's no stability, or just individuals that may have entered into shelters and then a couple of months later they're back out in the community, or they'll get an apartment and they'll lose it. And there are variables that contribute to that. Sometimes it could be the person's mental illness or inability to budget well, to manage their funds, and that will bring them back to the same state that they were in the beginning. Or they may have relapse. Okay, so that's where the addiction component comes into play. Contribution to homelessness and addiction. As we all know, the difficult conditions living on the street So some of the contributions are, one, being robbed, bad weather, not knowing when the next meal is coming, or even safety issues that may have come. No. Okay. Sleeping, where to sleep, safety issues. So now you sit there, you think about it. I'm homeless. I have the stress of not having a safe place to stay. Now we think about Maslow's hierarchy of need, which means safety is number one, right? So if I don't have a safe place to stay, a stable household, now that's creating stress. And then now I'm in the community, I'm in the streets, I'm going from place to place, from one corner to another corner. Okay, or one abandoned building to another abandoned building. And then if I have children with me, how is that? Now I have to factor in how I'm going to keep them safe. How do I keep them warm, especially when the weather's changing? Okay, or if I'm sleeping in my car, how do I keep the car running? How do I keep the car not getting towed or getting ticketed? Okay, so those are some variables as a parent or as an individual have to think. So what is the best coping mechanism to use? Which might be drugs, which might be alcohol. That's how, if somebody was not using drugs or alcohol prior to becoming homeless, and now they are homeless, that's where it becomes more appealing. Because as we know, by using a mind-altering mood substance, what tends to happen, it reduces our focus on the real issues that we're dealing with, so we could actually be able to minimize or just isolate ourselves for a short period of time. And as a result, those are the things that happen. So if I'm high on drugs, or if I'm under the influence of alcohol or drugs, I don't have to worry about being robbed. I don't have to worry about, wow, it's really freezing cold out today. I don't have to worry about where am I going to sleep or my safety issues. That's the least of my concerns at the time. The other contributing factor to addiction is, how am I going to find food? Okay, I'm homeless. I'm either working or I'm not working. I'm working enough to just pay the rent, but I'm not working enough to do groceries, or to pay the electricity bills, or to pay to have a decent bed to sleep in. Okay, so what may happen is, as a result of that, I may have to look for food pantries, right? Or I may have to panhandle. And yes, there have been studies that have been done where panhandlers do make a decent amount, but at the same time, Not everybody's going to give me, how long do I have to stand in the street begging or asking for money to be able to buy some type of food or to be able to make it for transportation to get to and from my next destination? And as I mentioned before, if I have children, how am I going to be able to support them, or even before the state get involved, somebody call the police or DCP&P to be involved in those children's lives to be taken, removed from my custody, okay? Or not eating healthy, right? If I'm making $5, $10 within that time frame, I have 2 or 3 kids with me, what food is going to be healthy? So that contributes to more stress. That contributes to more worries, more concerns. And if I'm not eating right, that means my health is struggling, which brings into the next bullet point, which is struggling with ill health. Where am I going to go to the doctor? Where am I going to take my medication, even store it? Do I want my medication on my possession, especially if I'm living in the streets, because that increases chance of me getting robbed. That increases chances of me getting assaulted. And at the same time, perfect example, if I'm a diabetic, how am I going to, and I'm on insulin or even on metformin or any type of diabetic medication, how am I going to take my medication? How am I going to store my medication to make sure it's appropriate for me to take when I need it? Okay? How will I be able to make sure that I keep my doctor's appointments because I don't have any reminders? Those are the ones that's living in this community. Those are the ones that's living in the streets. But how about the homeless that's living from house to house? Living from house to house is only a temporary basis until the person you're living with says, you know what, I'm tired of you being in my household and I need you to leave. So now that opens a door and says, how much can I bring with me when I go to this new friend's house? How long would I stay there? So certain things along the way, you may get lost. You may lose some documentation. You may lose some items, some clothing. You may lose some medications because you're rushing out of that current place. And at the same time, that increases safety concerns as well, okay? And finally, the last part of that is saying individuals suffering from homelessness may additionally develop psychiatric conditions in response to a harsh lifestyle of feeling threatened by violence, starvation, and lack of shelter and love. So when we're talking about the psychiatric illness, you're like, well, what would be the psychiatric illness that one can develop as being homeless? And that could be depression, okay? Or serious anxiety or paranoia, okay? The anxiety stems from not knowing how to relax. If you're constantly on high anxiety, constantly tense, how are you able to defuse? How are you able to relax and say, I could focus on finding this job. I could focus on, let me register for this homeless shelter. Or I could focus on getting my kids enrolled in school. I could focus on taking care of my health so I could be able to focus on getting out of the situation that I'm in. So that increases anxiety, and that could also trigger other type of illnesses, maybe health concerns as well. Does anybody have any questions or comments at the same time as we're continuing? Like as I said before, feel free to chime in at any time, okay? All right, no. No. How do we move to the next slide? Okay. Now, with substance use disorder, as we all know, substance use is a disease that affects a person's brain and behavior and leads to an inability to control the use of illegal or use of legal or illegal drug or medication. As we all know, in the past couple of years, we have had the opioid epidemic, and the way that most of the individuals that have occurred, that's gone into this, is not only from the heroin use, it's from pain management. Okay, so you get hurt. You never used drugs or alcohol in your life, or you're just a social drinker. And now all of a sudden you had a bad car accident or a bad fall. You go to your primary care doctor, you start prescribing some medication. Unfortunately, it may lead to an addiction. So now that opens that door. Now you're saying that I need this to function. Okay, it goes from mild, moderate, and severe. Those are the 3 categories that we use in the DSM-5 to categorize substance use disorder. It used to either be substance abuse or substance dependence. But with the mild, moderate, and severe, it helps the individuals such as myself, a licensed a licensed drug and alcohol counselor, to be able to identify which level of care I would be recommending somebody who's using drugs and alcohol. Okay, so now when we do the evaluation, we'll take into consideration the person's living environment. Because if you're coming to my program and you're saying, you know what, Pascale, I'm struggling with my drug and alcohol usage, I'm going to try to place you in a program to help you deal with the addiction. But I have to factor in what's going to happen to you after you leave my facility. Where are you going to get help? How are you going to continue on with your recovery process if you don't have a stable place to stay? Okay, so this is where, as a clinician, we have to play case management. As a case manager, we're dual roles, and be a case manager as well to say, okay, you have an addiction problem. Now let's help you find a shelter or a stable place to stay until you're able to get back steady on your feet again. And by addressing those two issues, you'll see the recovery process for an individual go to another level. Okay, because now that stress of not having to worry about a stable place to stay has decreased. Okay, and I could focus on me dealing with this a disease of addiction. Okay. So as you know, with addiction, it has different categories. We have alcohol, we have marijuana, nicotine are also considered some drugs. However, nicotine usage is kind of minimized when it comes to substance abuse and addiction and homelessness, because it's not going to impact the individual to the point whereas alcohol and marijuana or heroin or cocaine or MSD, methamphetamine may impact them to the point that it controls them and they can't function without their daily usage, or they'll could lead them to overdosing on such those type of drugs. Homelessness. What is homeless? It's a state of having no home. Okay. Now you're saying 90% of the time when we think about homelessness, we're thinking about individuals that's in the community, just walking around, spending all day in the street until they either go back in the shelter or they go back into their area where you may find most of the homeless population congregate, or some individuals have been even slept in the woods. Okay, they look at it as an everyday camping, or even at the state that they go to, sleeping in the car. Okay, so as they're doing this, they're looking at a way to cope and deal with it. But one of the key things that's contributing to the homeless population to make it difficult, one of the hindrances that also impacts the homeless is how are we going to help them get out of that state, which we'll discuss later on. We're going to deal with the addiction. But how about the shelter part? Okay, we got you to a shelter. How are we going to help you retrieve some of your paperwork that you probably lost along the way of you going from shelter to shelter, or from friends and friends, or from being transient, moving around from abandoned house or from vehicle to vehicle, okay? Or if your items were confiscated, or if your items were lost or burned. So that also creates more stress for the individual and trying to regain their life again to where it used to go, even better than where it was before. Okay, so the types of homelessness that we may encounter are situational homelessness. Situational homelessness is varied. Okay, along some of the things that we discussed, which may be individuals who have lost their house through a fire or a natural disaster, has lost and don't have no family support, or they've been kicked out of the house, or their health required them to use all their resources, and eventually they couldn't support themselves and they got evicted from their home. Okay, that could cause homelessness. Transitional short-term homelessness. Okay, it defines a person forced into homelessness due to a life event, as we mentioned, loss of a job, disaster, losing a family member who is breadwinner, domestic violence. Okay, all those are areas that we may encounter individuals somewhere in some form in our place of work. Okay, as working in an outpatient program, working in an inpatient program, I've encountered, especially around this time of year, individuals who suffer with it, that are homeless and suffer with the disease of addiction. They'll try to enter an inpatient program just to get away from the heat, the winter storm. Okay, so they don't have to worry about 30 days of where am I going to sleep. But they can't bring all their items with them. They're limited to the amount of items that they can bring with them. Okay, but then what about in the summertime? In the summertime, I'm not worried about being homeless because it's a nice weather outside. I don't mind sleeping on the bench. I don't mind sleeping outside because the weather's nice. Okay, so as an addict, they'll say, hey, you know what? I'm high. I'm in the community, nice weather. That's the best combination at the same time. Okay, so which makes our job kind of difficult to say how can we reduce this rate of homelessness and the addiction? How can we help them understand you can still enjoy this time without being calculating to say get into a shelter or get into sleeping in the park bench in the summertime or worrying about when your next meal is going to come. Many factors causes homelessness, not just substance abuse. In 2015, Hunger and Homelessness Survey identified lack of affordable housing as the leading cause of homelessness among unaccompanied individuals and families with children. In Morris County, as I mentioned before, is very expensive. So we could also sit there and think of the cost of living in Morris County, okay? And when you look at the pay rates, okay, the salaries, the income of those individuals. So as we know, one of the main homeless shelters in Morris County, they help the people get jobs. But if I'm working at ShopRite, making minimum wage, and I only get 20 hours per week or even less than that, how am I able to afford that one-bedroom apartment in Morris County for $1,000? Now, that is a nice affluent area. I would love to live there. It's great, good school system, but I have to be reasonable to myself and say, can I live in that area for what I'm making? Okay? So then now, we as professionals, we have to say, how can we help them understand that, great, at this time, this might not be the best place for you to reside, but we could help you find another place which is much more affordable, or even supplemental housing that you could apply for. Okay, and then back to it again as with the children. How do we deal with the families? Okay, they're the families. How do we help them understand to give them the support that they need for the families, as the main breadwinner, or even the victim of a domestic violence? Okay, poverty, unemployment, and low-paying jobs were also major factors. Okay, as I said, economic insecurity, varies at home, mental illness, and lack of social support also lead to homelessness, the survey found. Okay, as we move to the next section, we're going to be looking at the different types of homelessness that's there, and one of the types of homelessness is the mental illness. Okay. So the mentally ill, about 33% of homeless population in 2017 are diagnosed with mental illness, which means bipolar. Some most of the popular listed as in front of you: bipolar, severe anxiety, major depression, schizophrenic, and PTSD. Okay. Now, all these mental illnesses require them to take medication. As I mentioned before, how could I take my medication if I don't have a safe place to store it? Okay, how can I take my comply with my medication if I don't have the reminder to take it? And at the same time, do I want to take my medication for me to deal with the everyday acknowledgement that I'm sleeping in the streets, or I'm being transient, or at the state where I am right now, being homeless, not being independent, not having my own? Sometimes it's not necessary that the person is using drugs because they're down and out. They're using drugs to cope. They're not taking a mental health medication because they don't want to deal with the reality. And sometimes not dealing with the reality is the best way for them to deal with their current state of mind, which makes it difficult for us as a professional to try to engage them into the recovery process. Okay? So, as we all know, if you're going for a period of time without taking mental health medication, that could lead into other type of issues that you may have as you continue on as in the process of recovery. Okay. Young adults, that's another population that homelessness tends to target. Okay. As you know, ages 12 to 17 years old are at greater risk of homelessness than adults, and many homeless youth have been the victims of severe abuse. Why do you think, and as I said before, you guys can chime in, text, chat, and this is a question if you're able to answer for me. Why do you think 12 to 17 years old are at a greater risk for homelessness than adults? Hello? Okay. So the reason why that would be is because of some of the stress that they may have, that they may experience, right? So say, for instance, back to the same issues that they may experience as with the adults, if the main breadwinner passes away, Okay, if they were living their house burned down. Okay, they ran away from home. They were sexually abused. They were taken by the state, and they couldn't stay with the current lived state of that they were in, whether it's DCPNP or foster care. Okay, they didn't have any other family members to take them in, so they would be placed in a homeless shelter for kids. Okay, so how do you explain to a 12-year-old that your living situation is different from the other kids that you go to school with, that your living situation is different than it was 2 weeks ago? Okay, so what is the means of coping? So the means of coping would be survival, which is, hey, you know what? I'm going to do I'm going to internalize this anger, and I'm going to display in my behavior. I'm going to seek drugs. I'm going to seek alcohol. Okay, I'm going to either join the gangs or steal or do things that's not appropriate, or what is that I would like to see myself involved in, but I don't want to deal with my current situation. I need to cope. Okay, so 71% of missing, runaway, throwaway, or abducted children reported a substance use disorder. Youth have a maladaptive coping mechanism to stress. Which is expectable. A 12-year-old should not have to worry about what they're going to eat the next day. A 12-year-old should not have to worry about, if I am diagnosed with medical issues, where my medication is going to be. A 12-year-old should not have to worry about, can mommy or daddy pay the rent. A 12-year-old should not have to worry about certain things that the adults who are in their care are supposed to take care of. But unfortunately, that does happen. So you're dealing with a 12-year-old mind frame, you're going to react as a 12-year-old. Okay, you're dealing with as a 17-year-old, you're still going to react that way, even though you're old enough to get a job. But still, I'm not going to focus on, hey, let me go and apply for this job. Let me go continue in school. Now, that is not saying that all 17 or 12-year-olds or age range kids that falls within that age bracket necessarily go and use drugs or necessarily have that negative thought process. However, for a short period of time, 71% of them, as per data, has showed that this is what happens. Okay, and this is how they cope. Okay, and also too, co-occurring disorders, right? Early use of substance use, using at a very young age, physical, sexual, emotional abuse, running away from home. Why would a kid run away from home? What's going on in that household that's causing them to say, I want to run away, I want to get away from you? The physical, sexual abuse, and emotional abuse that plays in it. Early use of substances, okay? Co-occurring disorders. No kid wants to be diagnosed with a mental health diagnosis. Even adults don't even want to be diagnosed with mental health. But now you're sitting there thinking that you're 12, between the age of 12 and 17, you're going to be diagnosed with mental health. The first thing you'll ask is, why am I different? Am I different? Okay, why me? So then now you have that diagnosis, and now trying to get them to follow through with taking medication. Okay, why should I take the medication? Why am I different than my peers? Okay, so, and then at the same time, if I am being in that predicament, now what about being teased at school? Okay, so this is something where some teachers, that's a telltale sign for them if something's going on with the youth. If at one point they were going to school every single day, and then now they start to miss school, okay, or they go weeks without attending school, and then they're all of a sudden miraculously appear. Or if their clothes are disheveled, or their clothes are dirty, or their hair is kept or so. Those can be, and their behaviors, if they were very good classmates, paying attention, now they're reacting, where they're being rebellious, they're talking back to the teachers, they're being disruptive in class. Those at times are telltale signs to say that something's going on with the youth. Maybe we need to talk to them, maybe we need to pull them aside. And that's where you may find out that this youth might be homeless with their parents, or might be struggling with their parents, and they don't know about the resources, or they're just being ashamed. Okay, and that also too with the co-occurring, it could increase depression. Okay, symptoms of depression, suicidal. As you notice that kids, there's an increase in kids committing suicide. Okay, all those factors can be contributing to the fact that this youth might be homeless, and we don't even we're not paying attention to that, because we're thinking, we tend to equate homelessness with adults, but not with a youth. okay? Because if they were homeless as a youth, that means that DCP&P would be involved. But at the same time, DCP&P may be involved, but still they didn't communicate the extent of what's going on with the youth, okay? Substance use and homelessness. Addiction disrupts the relationship with families and friends and often cause people to lose their jobs, okay? So as we all know, the typical stereotype of addiction when we think about it is the fact that, hey, you use drugs, it takes over your life, and now because the money that you're spending on the drugs, it causes you to get homeless. It causes you to lose your car, causes you to lose your job, causes you to lose your family and friends. That is true. It can contribute to that. However, it goes back to what we said before. What comes first, the chicken or the egg? That is based on a case-by-case basis. At times, when somebody is using drugs, of course, it starts off as friendly, social, and then it develops into everyday occurrence. And then before you know it, it's now a permanent part of their lives, a permanent fixture. That is the first thing that they do. Without realizing that, hey, I'm spending from $5 to $10 to $20 to $100 and more on this substance, but I'm neglecting some key areas in my life. I'm neglecting some key sections, which might be paying the rent, which might be, sure, what is your question?
Oh, sorry, I didn't want to interrupt you. It was actually about the last slide, that 71% number that you had. Do you know where that was from and how they collected that data?
Shoot, I'm trying to go back to the slide, so it won't let me. Okay. Most of the data that I received was from the National Council of Homeless, the Coalition of Homelessness, which I did put on there, and that was done. They were done through surveys. Yeah. So that information I received is from the Addiction Center, and from surveys that were conducted. I could try to find some more information to that, and then I could give it to Allison to provide to you if you want.
Okay, thank you.
You're welcome. Okay. So as we all know, why do people use drugs? That's one of the reasons why people use drugs. Okay. So what are some of the negative impacts of drugs and alcohol? As we all know, it could impact you psychologically, it could impact you physically, it could impact you financially. But the other key part is it impacts your relationships, okay? So, but it all depends on what's going on in the household. Sometimes the person could be really stressed out. It could be domestic violence, it could be sexual abuse, it could be emotional abuse, verbal abuse, any type of abuse that you could possibly think of. It could be occurring at the household, which is also contributing to the stressor and says, hey, you know what, let me go and drink. Now, not necessarily that just because that leads to, that's the one of the factors. Other people may use other reasons to want to cope with their to start using drugs and alcohol, and also too the homeless factor. It could be lack of inappropriate spending. Okay. Because I like earlier today, I met with a couple and they were saying the husband is working part-time, the wife is working full-time, but they're spending as if they're both working full-time, okay? But the stress is there. So what is the coping mechanism that they use? They may stay out a little bit longer, hang out with friends, or may just do, they start arguing, more conflict with each other, okay? So then now, because they're spending, they're falling behind on their bills. And before you know it, what happens? It gets into eviction notice. And that's where they were at the point in time that I've met with them. So in that sense, and as I mentioned it, although they say substance use and homelessness, it's not necessarily one is before the other. It could just be just day-to-day occurrence, poor decision making. Okay. I don't know if you guys remember that gentleman that I think he was, where was he? They found him in the community. He had this voice that was just like a radio voice. And in his case, he wanted, they interviewed him. He said he wanted to get a job and get back on his feet. A radio company called him and said, hey, you know, I would like to hire you. And they did give him an opportunity to work, but they didn't factor in his alcohol problem. Okay. So when he got the job, he was back to within weeks or months. He got the job, he got an apartment, he had an influx of money. They say he factored his alcohol problem. He also had to learn how to re-budget again, of being responsible. For the years and amount of times that he stayed in the community, his mind developed to focus on how to deal with what he earned at that time to function for that day. So if it meant I made enough money to eat one meal, that's what I made enough to eat one meal. But if I made enough to buy me a case of alcohol or drink, that's what I'm going to do. But to supplement it, at least I ate for the day. But now when I'm making thousands of dollars per week, or even every 2 weeks, I'm bringing $3,000-4,000. How do I budget that? How do I budget having to pay rent? How do I budget having to take care of my daily necessities, my grooming, my hygiene? Okay, you have to eat every single day. Or does that money with the addiction thought process says I'm going to drink, I'm going to spend more money on alcohol now that I'm getting more consistently? And unfortunately, he had to enter a rehab program because the disease of addiction was that powerful. It says, hey, you know what? I'm bringing thousands of dollars. That means more alcohol I could drink. Okay? It's not saying that I'm able to get what I really wanted, which is back on my feet, but nobody factored that in to connect him with a program to say, let's help you get back on your feet again. Let's help you go through the process. Let's help you go through emotions of budgeting, of organizing yourself. Can you handle that? Transitioning from being in the streets to now having a roof over your head again. Okay? How do I? Allison, I need your help. Okay. So with the young adults, it went back. Now when I need to go back.
You got it.
So the substance use and homelessness in 2008 survey by the United States Conference of Mayors asked 25 cities for their top 3 causes of homelessness. They, of course, listed substance use as the single largest cause of homelessness among single adults. Okay, reported 68% of cities. Substance abuse was also mentioned by 12% of the cities as one for the top 3 causes of homelessness for families. And according to that, Dininco and Pencrest in 2007, 2/3 of homeless people report that drugs and alcohol were major reasons for them to become homeless. Okay. Now, what I did was I listed, according to the DEA for New Jersey, I listed the cost of the drugs. Okay, those in certain areas across New Jersey, and where you see Opening and Vicodin, those prices are in Camden County. So now you're saying to yourself, okay, as a good Samaritan, or even where you're panhandling, right? As I mentioned before, I'm drinking, I could eat. Do I make enough money to buy the drugs, or do I make enough money to buy me a meal for the day? If I'm by myself, or even with kids, there are parents that use drugs with their kids present. As if the kid's falling asleep, they're asleep. So you know what? I'm going to go and get high because I can't see myself, except the fact that as a parent, myself and my children in the community or in the homeless, or sleeping in the car, or sleeping in an abandoned house or on the floor. Okay. So what I do is I panhandle for an hour or 2 hours. I make about $10, $15. That's the minimum across the state across the United States. $15 is the minimum you would pay, I think, in Chicago for a case of beer, or $31 in Alaska for a case of beer. Okay. Marijuana costs $10 per bag and up. Heroin costs from $5 to $7 a bag. Cocaine costs $39 to $60 a bag. Meth costs $50 to $100 a bag. Synthetics, which may be ecstasy, from $3 to $10 per pill. Okay. Oxycontin milligrams, $15. Percocet, 10 milligrams, $5.50 to $11. Roxycodone, 30 milligrams, $20 to $25 per pill. Opium, 40 milligrams, $25, and Vicodin, $10, 10 milligrams for $10 to $12. That is, like I said, Opium and Vicodin, or those prices are issued from Camden County. Okay, so then now, if I'm able to, the cost of my drug or the substance is that low, especially the heroin or marijuana or the ecstasy, or even the Percocet, why would I try to with the addiction process, the disease and addiction, how would I be able to focus on, let me take that money and go get me a meal, or let me take that money and try to prepare myself or go to a place, get a haircut or shave so I could be prepared for my interview. I'm not thinking that, okay? I'm not thinking any of those things. I'm thinking that I made $10 from panhandling for the last 30, 40 minutes or past hour and a half or 2 hours. Let me go back to this dealer and get me some more drugs so I don't have to cope for the next couple of hours, okay? And then what happens if you talk to the homeless population, they will tell you they know the time frames of when to go eat, okay? So if this shelter is open at the food pantry is open at this time and they give me a hot meal at 9 o'clock or 8 o'clock from 8 to 12 or 8 to 10, from 10 to 12 p.m. afternoon, what am I going to do? That gives me enough time to panhandle. That gives me enough time to walk around the community. That gives me enough time to go stand by McDonald's and beg or ask somebody for something, okay? Or if I drop my kids off at school in the daytime, that gives me enough time. I know they're eating at school, so what am I going to do for my time to spend for myself for the next 6 to 7 hours? Okay, so that's what the addiction process is thinking. Or even if it's cold, okay, let me go into a program. I may present my illness to be as severe that you may decide, you know what, this person meet criteria for a partial care program, or this criteria. So you know what happens from 9 to 3, I'm in the partial care program. I ate lunch and I'm in a warm place. But what am I going to do when I leave the shelter, the program? Okay, so from 3:30 to the next day, how am I going to cope? In certain shelters, unless it's the weather, they do ask the clients to leave early in the morning. So they may kick them out by 7 o'clock in the morning, not open back the doors until 5 p.m. So from 7 to 5 p.m., what is this individual doing in the community? What are they doing? How are they coping? How are they staying warm? And as we all know, you drink a glass of gin or a glass of warm, you're going to be warm for a period of time. Okay, but if it's the summertime, what do I need the shelter for? What do I need to? If I could get my fix, and I know what time the food pantries or meals places are open, I get a decent meal that could take care of myself. And if you notice, as I mentioned, not once I mentioned taking medication, going to the doctors. I'm not going to think about that. And one thing you'll realize as you work with this population, with the addiction population, they'll tell you, as I'm doing the drugs, I didn't have any problems. It's when I stopped doing the drugs, that's when I start going to the doctor, and all of a sudden I have all these medical issues bothering me. All of a sudden I have all these medical problems appearing, not realizing that you had these medical issues for a period of time. You just never took care of it. You were self-medicating. And that's a phrase, if you're not, that's very popularly used amongst this population, self-medicating. Okay? Is there an increase in drug use during homelessness? Alcohol, 67% of homeless youth in shelters use alcohol. Okay? Youth with homes, about 64% use alcohol, 25% use marijuana, and 2% use crack cocaine. Okay? As you notice, with the homes, alcohol, almost everybody's house has alcohol. If you have kids, it's easy. You have a friend who's 18 years old, 21 years old, or an older friend, here, go buy this for me and I'm going to drink. Okay? Marijuana, as you know now, especially with it becoming legalizing, that's the only thing you smell. You could be driving by, you smell marijuana. You walk and you smell marijuana, which makes it very difficult for us to engage the kids and say, hey, you're still developing. You should not be doing drugs. But how do you approach a kid who's in the system, who's constantly going from shelter to shelter, every 3 months probably changing, or not in a safe place in a residential program, or not a safe place at home? And that's their means of coping, because they don't want to deal with their parents' aggravation, or they don't want to deal with their current state of mind, their abandonment or rejection that they're feeling. Okay, marijuana is 75% of street youth, and I think 52% shelter use marijuana. Cocaine, 26% of street use, and 8% shelter use crack cocaine. Now, with the crack cocaine, it all depends on what county you're in, because certain counties, especially with kids, that's not really a substance that they really go for. I know Essex County is mostly marijuana, Xanax, That's a big thing. Alcohol, but mostly marijuana and Xanax. Okay, you may get a few kids that may do some Molly pills, but it's not as much. Okay, Union County is the same way as well. Okay, women in homelessness, right? Between 50 and 60% of homeless women suffer mental and emotional disturbance, often predating their homelessness, right? Many homeless women become homeless as a response to escaping past laden with domestic violence or sexual trauma. Some are victims who fled the hard grip of sex trafficking. Okay. Now, as mentioned before, when saying suffered, with women suffer mental emotional disturbance, that can stem from some of the sexual domestic violence or even some form of PTSD, some traumatic event that happened to them when they were children or in the past as they were growing up, or depending on social environment or life skills. But that's not necessarily all women. And what tends to happen is, as people, we suppress our emotions. We suppress our emotions. By suppressing our emotions, what happens is, or we try to compartmentalize, it shows in other areas in our lives, which makes it difficult for us to cope. So we may have mood swings, we may become depressed, and to escape, that's where we may indulge in probably 1 or 2 glasses of wine, maybe a glass of smoking marijuana, or even certain pills, okay? But that's not necessarily 100% guaranteed. These factors, along with co-occurring disorders from homelessness, have contributed to that. Approximately 1/3 of homeless women have abused heroin and crack cocaine at one point or another. Another thing with that contributes to women using drugs is could be relationships that they're in. So they could be in relationship with men that are abusive or indulging in drugs, and as a means of trying to please this man, of trying to make him happy, they too start indulging in the drugs. They too start involving themselves in illegal activities, which then opens up the door for them to start getting their addiction. Okay. Any thoughts, questions, or comments, or anything that you guys care to add? Okay. The LGBTQ population suffers from high rates of drug and alcohol abuse. They also have a 120% higher risk of homelessness. Why do you guys think that is, though? Why do you think the LGBTQ population will have a higher risk for homelessness in comparison to the other population groups that we've discussed, such as women, young adults, just the adult population or the men?
I think lack of social support related to stigma.
Yes, that's one key factor. Anything else you guys care to think of? Okay. So as Allison mentioned, family doesn't agree with their lifestyle. That is true. That is the biggest problem for LGBTQ population, because one, they feel abandoned, they feel rejected. Okay, not having that emotional support to say to their parents or to their cousins or to their brother or whoever it may be, a family member that they grew up with, and say, you know what, this is how I feel and this is who I am, and to be able to express their concerns, their frustration, they internalize it. Okay, they feel alone. So that's where they could be pushed more out to indulging in inappropriate behavior, in inappropriate activities to try to cope before it gets too late. Okay, homeless lesbian women report higher numbers of alcohol abuse in response to their disorder and minority stress. Okay, when homeless, they are more subjected to violence and sexual assault compared to their heterosexual counterparts. Homeless is more common in the transgender community, as members of the transgender community often struggle with job discrimination. Okay, even in 2019, and we're about to enter 2020, there's still in the amount of progress LGBTQ population have received, being able to get married, being able to get on the insurance panels. They still experience certain, adopt kids, they still experience certain discrimination. And the worst part is the job. Why is that? It's more of a fear, it's more of a not understanding. And because of that and the judgment, it makes them difficult to be able to take care of themselves. As And if you can't afford if you can't get a job, that makes it very difficult for you to support yourself, especially a legal job. So then now what does that happen is you're tempted, or it can lead you to influence you to get jobs working inappropriately by either selling drugs, either prostituting, or other type of inappropriate behaviors. But by doing those risky behaviors, what happens is it runs the risk of you getting arrested. And by getting arrested, that means that you're getting charges. So then, as you know now, when you're applying for an apartment, they do background checks. And depending on what charges that you have, they may deny you the apartment. They do credit checks. You may not even get the apartment because you have a poor credit score, which means you didn't have a job to pay your bills. So then now, not only am I feeling isolated, not only if I'm being judged or discriminated against, I don't have a steady place to stay. I have a legal problem. So that means I can't get a job. I can't get an apartment. And what else is next? So how do I cope? I get depressed. That's where the thoughts of suicide is increased. That's where the thoughts of drug-induced increases. Okay? So this is where also, too, when we're working with this population, we have to consider all these factors, all these variables, and say, not only does the drug counseling for the drugs, but also counsel individuals to help them stay focused. So when I counsel individuals for addiction, one of the things I suggest to the staff or to my clinicians is to focus on the issue at hand, not just the drugs itself. Because I can give you 80 million reasons why I use drugs, but what about me staying home, about the problem, whether it's finding a job, whether it's my homelessness, whether it's my health. So if I address all these other variables in addition to the addiction, what do you think? That increases my chances of getting on recovery, staying in recovery a lot much better. One guy that I was working with, he stated, he's like, if I get a house, if I get a job and I get my own place, I'm not going to use no more. And you know what? He got that job, he got that house, and he's been clean for a good 10 years. And that's where, as clinicians, we have to listen to them. They know what some of the issues are. It's just we listen to give them that additional support. So when we work with treating the homeless population, these are some of the things we consider. Housing access. A stable living environment is a critical factor in recovery for the homeless. Where are they going to go? In Morris County, how many shelters do you have that, and when you look at the shelters, would you consider yourself to stay there if God forbid that happened? And that's how, if you would be willing to stay at that shelter, that's where you say, you know what, that's a shelter I'll refer people to. And that's something you think about. Are there enough shelters in Morris County to house the homeless family, the homelessness? As we noticed, as I mentioned before, there's 398 people that's currently homeless in Morris County. Do they have the current places to stay? And those are the people that's counted for. How about the ones that's not counted for? The numbers might be a little bit higher, okay? Well-trained staff with compassion, flexible, and experienced care is vital to effective program, because you do not want to get people to work with the population. They're very judgmental. They're very critical, okay, criticizing them, putting them down. They think they're better than them. And that's one of the things that that people look at, and I think all of us could attest to it, is when we meet somebody, how do we feel? What's the energy that we have? If once we feel that the person is judgmental, then automatically we don't want to interact with them anymore. So now picture with somebody who's down in their luck and they feel that, hey, you know what, here's a person who's supposed to help me get back on my feet, but they're judging me. They're blaming me for my homelessness. Why should I come back to that program? Why should I even listen to them? If they say, hey, this place is hiring, why would I even give them that opportunity? Okay? Client-centered services. Is the program treatment plan catered to that individual, not as a group? Granted, you may encounter individuals that every single they may appear to have the same foundation. However, they're not. They're still individuals. So when we make the individual case management plan or treatment plan, are they tailored to that individual per se? Okay. Integrated services. Since the homeless often have co-occurring mental illness issues, have multidisciplinary professionals in-house and can provide centralized, coordinated treatment for greater effectiveness. And if you don't have the team, like the psychiatrist, the social worker, the therapist, or the groups of the counselor, CADC counselor on staff, do you have organizations that can tailor to that? And how about the ones that don't have insurance? So if they don't have insurance, will the program absorb the cost for their treatment? Will they refer them to the program that could assist them in obtaining health? Because remember, if I'm co-occurring, that means I may need medication. So if I don't have insurance, how am I going to get my medication? Do I have a program that could prescribe me medication and cover the cost of my medication until my insurance is activated? Okay. Comprehensive services addressing the many complex needs of the homeless person, including survival and social needs. Okay. Remember, health, reintegrating back into the society again, removing that shame, that guilt, that embarrassment that they felt by being homeless for that period of time, especially if they have kids. Also, do you have counseling to offer for the kids if it's a family base? Okay. Other type of treatment, this is for housing, for addiction, sober or dry housing, strict abstinence policy. Substance use can result in termination of housing. Do we have to help them understand that? Because at times, as I mentioned before, these people, the homeless population with addiction, if they've been in the community, in homeless for a period of time, for a few years, transitioning to living in an environment that's structured with no drug use might be difficult. So how are we going to help them transition to that, get stable, to understand that as this is my house, this is my bed, this is my room, this is where I stay along with other people, I have to respect it enough not to use drugs. How the impact of drugs, and if I do use drugs, what's the violation, what's the consequences of it? Okay. Damp housing, people both with and without substance use disorders live together. Okay. Wet housing, use the harm reduction approach that refers class to substance use treatment services. However, it does not require participation. Alcohol use, but no illicit substance permitted. Okay, so now that might be one of the best things to try to help them with, especially the last one, which is wet housing, where okay, we're gonna get you back into, you're gonna get approved to stay at the shelter, but since we identify you have an addiction, you're going to be required to go to a program. You're going to be required to see a counselor to deal with the addiction as your counselor and I work together to try to help you get back on your feet, to live a life which was clean and sober, and to reduce the chances of you getting back placed in this situation again. Okay? And then finally, guys, how to help. The way that we can help this population, is to get counseling. Okay, what are the counseling resources in your community? Do you know them? Do you trust them? Would you yourself? And as I said, the best way to check based on that is to see, would you go and seek counseling from that facility? And if your answer is no, then why would you refer a county to that agency? Okay, what are some of the resources outside of counseling and homeless shelters does Morristown or Morris County offer the residents or the clients, from youth to adults who are experiencing homelessness? Homeless Solution Shelter is one of the best ones I've known. Mental Health Association, Essex, Morris, and Sussex is another one. And Addiction Helpline for New Jersey can help you in locating treatment programs within the area to try to better service these individuals. I would like to say thank you. If anybody have any questions, comments, this is the time you can ask questions. I'll try to answer as much as possible, or thoughts and comments.
So Pascale, I wanted to ask a question. So my understanding is that Daytop, for instance, is like the last inpatient facility for youth, and that they are even struggling to stay open, and they actually happen to be closer to us. So the last one in the state is what I meant to say. What kinds of resources, I guess statewide, since there are so limited, are available for youth who are struggling and maybe need that level of care?
Okay, I know New Hope is another organization that's in South Jersey that does take youth that are indulging in drugs and alcohol. They have a shelter, they have an outpatient, they have a detox facility. and there's Daytop. I know with them it's marketing, okay, because I know of their program, so I try to refer people over to them, but not as many people know about it. They know about the New York agency, Daytop location, but not the Jersey one. So maybe that could help them in regards to recruiting and getting services for the youth. Hello?
Yeah, thank you. Could you also talk, a couple of slides ago, you had up about like damp housing versus dry. I had never really heard about that before. Could you talk a little bit? I'm not sure I totally understand what that is. Is that like that's like shelter or like a,
Yeah.
what is that referring to?
So damp housing is it's a treatment program. It's a shelter, similar to like the other sober living. So it's more how you implement to try to assist the individual in trying to get recovery. So it says people with both with and without substance use are lived together. Abstinence is not monitored. So what it means is you're integrating both individuals who are using drugs, who are still struggling early on, or just into the recovery process, with individuals who have no drug and alcohol usage period, or in recovery. Okay, and in that time frame, there's no real structure per se to say, oh, you know what, if you use drugs, you're gonna get kicked out the program. But it's mostly as if you need recovery, is there for you. You understand me? We could help you get assistance. We could help you get connect you to the agency, but you're not going to get kicked out of the facility if you get caught using drugs or using drugs, which is not. That's why I didn't really recommend it per se.
Are there any sites like that in the state?
Most shelters are like that.
Really?
Mhm. Most shelters are like that. I know in Essex County, there's one shelter that you would have thought that it was the drug program. I mean, you thought that even though you were inside the facility, it was you were outside in the streets, because that's how bad drug infested the agency was, the shelter was. And it was rare and few that the people that lived in there did maintain their recovery, or they struggled. It was so bad that the county had to step in and shut it down. Most treatment programs, that's what they do. Most shelters are like that in other counties, where individuals they assess you as having a drug program. Okay, you come in, but you just be required to go to a treatment program, which satisfies their need. They're doing the case management. You're going to a treatment program. Your urine's a negative, a positive or so, but as long as you're not using on site, that's fine.
Thank you.
Any other questions? You're welcome. Any other questions or thoughts or comments? You guys are quiet. Okay, so with that said, I want to thank you guys for giving me the opportunity to do this presentation. So I hope I was very informative, and you guys did get some additional information and resources. You have my email, I believe, or Allison can provide it to you. And if you have any questions or comments, you always call me back. Call me, email me, and I'll be more than happy to help answer your questions. Okay? All right.
Thank you,
care.
Pascale. I really appreciate it. I think we all do. I just wanted to double check. You also chair the Essex County CAS, right?
Yes.
So I forgot to mention that when I was introducing you. So I just want everybody to be aware that Pascale, she chairs our neighbor CAS in Essex County, and so she definitely has a wealth of knowledge. Thank you so much for joining us today. Really appreciate it. And yeah, I will be sending out in the follow-up email your contact information. Pascale has helped a local shelter organization with training for, right, and correct me if I'm wrong, for substance abuse like, I guess, what's the
Yes.
right way of Pascale? Yeah.
In becoming certified alcohol drug counselor. So if you or your staff may be interested in pursuing this, the CADC certified alcohol drug counselor certification, we could discuss it and see how we could I could offer the classes to your staff or to your team. I don't have no problem in going to your agency and offering the courses, and then we could take it from there. Because as mentioned, we are in an opioid epidemic, so knowledge is always the key to anything. So, and that would help too as well.
Right. So thank you so much, Pascale, and thank you everybody for joining today.
Okay. Take care.
Take care. Bye-bye.